Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, some of the highlights. Today, resident doctor strike enters day 3. Officials accuse federal government of insincerity in handling their welfare. Death toll from coronavirus in Nigeria soars in single day as NCDC records 455 from 424 yesterday. And Beijing's coronavirus spike continues as restrictions on travel are tightened. The death toll from COVID-19 has risen to 455 after the Nigeria Center for Disease Control, NCDC, announced 490 new infections across 15 states and the Federal Capital Territory, bringing the total cases in the country to 17,148, with 5,623 patients recovering. According to the NCDC, 25 of the 31 deaths were recorded in Lagos State between June the 12th and 15th, hence the announcement on June the 16th. A list of the latest infections are in Lagos, which has 142, the FCT 60, Bayelsa 54, Rivers 39, Delta State 37, Oyo 30, Kaduna 26, Imo State 23, Enugu 19, Kwara 17, Gombe 11, Ondo 10, Bauchi 8, Ogun 7, Borno 6, and Benue 1. Here's a breakdown by regions of the cases, indicating Lagos in the southwest, leading also in the country, and now with 7,461 cases, followed by the FCT in the north central with 1,324 cases. Kano tops the northeast with 1,158 cases. We have Rivers State, which has overtaken Edo State, the highest number of cases in the south-south region with 631 infections. Borno still leads in the northeast with 445 cases, while Abia State has 173 cases, the highest in the southeast. The National Association of Resident Doctors of Nigeria are not relenting in the nationwide strike as the industrial action enters its third day today. The president of the association, Dr. Aliyu Sokumba, is accusing the federal government of insincerity in their dealings with the doctors. He says up till now, none of the doctors working in the isolation centers have received their allowances. In his words, we had been promised that all resident doctors working in treatment centers will be paid their allowances. As I speak to you, nothing of such has taken place, as all the doctors are yet to be paid, and this is unacceptable.
The resident doctors have told us that they're not going to be returning to work very soon until certain other conditions are met, and we are not sure that they will not continue extending the goalpost every time we try to reach a solution. This evening, the Ministry of Health will issue a directive to all medical directors and chief medical directors of all federal hospitals, health institutions in the country, to open up a register tomorrow morning by 7 a.m. and record all those who come to work, and all those who do not come to work will be noted down. We have an obligation as the Ministry of Health to be ready to protect the lives of Nigerians.
That was the Minister of Health, Dr. Sage Hanire, yesterday at the deadlock meeting with the leadership of the resident doctors in Abuja on a fresh register now open for resident doctors to sign in after resumption of their duties. In the meantime, Channels Television has gathered that today public hospitals across the country have responded to the directive. A source at the University of Lagos Teaching Hospital, Luth, told our health correspondent that the registers were opened this morning for all the departments as directed by the Minister of Health, and this is being handled by the Human Resources Department. In some other institutions, the registers are open, but we understand that no one is signing. Let's go to Adamawa State, where the government says it has successfully treated all its COVID-19 patients in the state. The Adamawa State Commissioner of Health, speaking at the Infectious Disease Center in Yola, the state capital, reveals that out of the 374 samples tested for COVID-19, only 42 turned out positive, and they've been receiving medical attention at several isolation centers within the state capital.
Adamawa State announced its first case of COVID-19 on the 22nd of April 2020 this year. As of today, the state has tested over 374 cases. Out of these, 42 turned out to be positive, giving a percentage of 11.2, while 313, that is 84%, tested negative to COVID-19, while 5% are still pending. As we speak today, we don't have a single case on admission in our isolation center. The last case that was tested positive was 16 days ago. In collaboration with relevant government ministries, agencies, faith-based institutions and philanthropies, Adamawa State has established 5 isolation centers. 4 are fully functional. This includes Specialist Hospital Yola, Federal Medical Center Yola, German Hospital, Bishop Makanto Hospital, and Infectious Disease Center, commissioned by His Excellency last week. All these isolation centers were established to ensure that individuals who tested positive were properly attended to in safe and convenient facilities.
That's good news coming there from Adamawa State, and we hope that they remain COVID-19 free. Joining us in the studio here in Lagos is Mrs. Veronica Okugbeni, a clinical pharmacist, Deputy Director, Federal Neuropsychiatric Hospital, Yaba, Lagos. Thank you for joining us on the program.
Thank you, Millicent, for having me.
All right. First, let's look at our death toll. We're seeing a lot more cases so far, but in the absence of a vaccine, would you say that we're winning the war?
In Nigeria, I think we are not yet there because, in quotes, after the partial lockdown was lifted, people let their guards off. So you can walk in the streets of Lagos now, you see over 100 people, and they're not wearing masks. People are not washing their hands. So I think for us, really, the government has done their part. But if we as individuals do what we are supposed to do, the proper normal hygiene, wash your hands, use the hand sanitizer, use your face masks, I think this death toll will come down. But right now, I don't think as citizens we are really doing our part. So I think we need to change that.
So we understand that dexamethasone, something new from the UK government, has come in, and they said it's a possible treatment to reduce the risk of death, especially those on ventilators and the use of oxygen. What's your take on that drug?
Dexamethasone is a steroid. And for them, they did a study, like you said, they did a study in UK, and you said found out that, yes, that's actually helped those that are severely down with COVID. Because what it does is, for those people that have severe COVID, the immune system tries to fight the COVID-19, and so it just goes haywire. And that's why you have people coming down with immune system deficiency. So what this dexamethasone does for them, according to research, that it helps calm this immune system. And so for them, they've said, okay, we can use it, and it's for 10 days. But in Nigeria, NCDC has said no. It's not in our protocol. It has not been validated to be used in Nigeria because the side effects are very bad. And because we are a country, a people that don't obey rules, we can go to a pharmacy and buy it. We all know of the incidents that happened after chloroquine. When we found out that chloroquine could be used, people started abusing it, and they had chloroquine toxicity. For dexamethasone, it's also very bad. The side effects can come down with hypertension, can come down with diabetes. You can come down with deficiency in your immune system, and you'll be able to fight disease because you are abusing this drug. So NCDC has said no. I will encourage everybody as a pharmacist, please, please, please don't abuse this drug. It is not validated for use in Nigeria. we have a protocol in Nigeria, and dexamethasone is not it.
Well, looking at the World Health Organization, they issued a statement saying that this is the Director General, Dr. Ghebreyesus, saying that it is great news, a first treatment shown to reduce mortality in patients with COVID-19. Another thing which the World Health Body said is that the findings reinforce the importance of large randomized controlled trials, you know, that produce actionable evidence, which I guess doesn't occur very often.
Yes. Like why it's a welcome development is that the cost of dexamethasone is cheap to be able to treat a patient that has severe COVID symptom. So you cannot use it for mild, or you cannot use it for somebody that is asymptomatic. So what is like we've come to establish is it must be used for those that have severe COVID symptom. And they are still just working with a group. So they cannot really say, let's go out and tell everybody to use it, because the group that they use for the study is still small, and it's UK. And like we know, COVID is not a one-size-fits-all. It might work for them in UK because of their gene, and coming down to Nigeria, it might not work. So I think we still have to be very cautious about dexamethasone.
What's your assessment of the number of medications or treatment regimen to handling COVID in Nigeria?
I think in Nigeria, like Lagos State came in yesterday and was talking that they're still using chloroquine and hydroxychloroquine. So depending on what the finding is for Nigeria, we can still go ahead with it. So for now in Nigeria, I know most people are using antivirals. Some are using chloroquine. Some are using hydroxychloroquine. So depending on what the center is using and find effective, that is their protocol. So, and they go with it.
Let's switch to mental health. You know, this new normal is affecting people differently. Okay. How would you say COVID-19 has impacted our mental health in the country?
It has. We are people that are very sociable. We have parties every weekend, and in a way it helps our mental health, because God not created us to be an isolated people. Going out, it's part of mental health. So for now, COVID-19 is restricting all of us. We're at home. You cannot go and visit family. You cannot share your burden with people like you used to do. At times, you just need to see somebody to tell the person what you are going through, but that is cut off. Economics, it's also there. People have lost their jobs. People are being paid half. Some cannot take care of the family. It's affecting them. So that's why you see a rise in mental cases like the issues of rape, suicide, depression coming in. Then anxiety is another thing that is going on now, that we have an increase. Because normally if you have a cold, before COVID, if you have a cold, you just sneeze and you forget about it. But now if you have a cold, sincerely, you might not sleep that night, because you will be thinking... Or
even those around you might be looking at you
everybody's suspicious of you. Is it COVID-19? So you have anxiety on the rise now. You have panic attack on the rise now. So those are things that we know there before. People are not sleeping well, all as a result of the COVID. So it's really affecting mental health. But the truth about it is that COVID will come, COVID will go. Let's all deal with these issues in a way that it doesn't affect us, that we are now grounded, that we are not able to live our life. It will come to pass.
So do people identify these issues as a mental health problem, especially anxiety and then depression? Yes. And then how can they battle it in this COVID era? The first thing, if you notice that you're having anxiety or sleep issues, get in touch with your medical person, a medical professional. It can be as good as doctors, can be as pharmacists, psychologists, they are working. I know the psychologists, they are doing a lot with COVID patients, and even the caregivers themselves, and even the healthcare providers, because there's a lot of burnout, so they are working with them. And as much as possible, as pharmacists, we are trying to make drugs available to help. There are actually drugs that can help with anxiety, that can help with panic attack, that can help with depressions, and they're available in the hospital, and you can have access to them. So these drugs are available, and they can actually help with the mental health. All right, and that's under medical prescription. Yes. We'd like to thank you, Mrs. Veronica Okugbeni, Clinical Pharmacist, Deputy Director, Federal Neuropsychiatric Hospital, Yaba, Lagos. Thank you for joining us on the program. Thank you so much, Millicent. We have more on the COVID-19 updates when we return. Welcome back. Resident doctors in Calabar, under the umbrella of Doctors Time Out Family, have donated palliatives to the less privileged in society. The items include food. Non-food items were donated to the University of Calabar Teaching Hospital and the home of the elderly.
And besides this one, we are going to actually...
We donated 50 face shields to the hospital. We donated 200 pieces of 100 ml hand sanitizer. We donated 250 pieces of surgical face masks. And we also donated 2 cartons of gloves to the UCTH management for them to use and give to their staff so that they can protect themselves while attending to patients in this COVID-19 era. Here we are going to do a medical outreach whereby we are going to check the health status of the old people who are here in this home. We are going to check their random blood sugar. We are going to do urinalysis. We are going to check their blood pressure. Some of them are old and they're having arthritis. We are going to make donations of medications, cutting across hypertensive medications, drugs for treatment of diabetes, drugs for anti-malarials, as well as analgesics for those that are arthritic.
And still talking about the vulnerable groups and the impact of COVID-19 this period, we have Dr. Olufunto Kalejaye, a consultant physician and hematologist. She joins us here in Lagos. Welcome to the program.
Thank you for having me.
First, I'd like to ask how you think vulnerable groups are coping in this COVID-19 pandemic era.
Well, the vulnerable groups have had to have extra precautions in place, so to speak. Apart from following the NCDC guidelines about safety precautions, washing of hands as often as possible with running water, going about with your hand sanitizer, practicing what you call respiratory hygiene, wearing of face masks at all times. They've had to be extra careful as well. They have not been able to go out as often or as much as the other people would have liked to do. So I think they'll probably feel more of the pressure from this COVID-19.
There is that, and there's also the economic impact for some others. Yes. But let's zero into talking about a sickle cell patient. Do we have a guideline for a sickle cell patient in COVID-19?
Well, yes, the American Society of Hematology actually does have a guideline which we follow. Now, apart from the World Health Organization guidelines, like we spoke about, the hygiene, maintenance of hygiene, social distancing, very, very important, use of face masks, washing of hands. We also advocate, as if they can work from home, it makes things much easier. And where it's absolutely necessary for them to go, they must wear their face masks and maintain social distancing as best as possible. What we also tried to do was to make sure that we give prescriptions that could cover for long periods, like 3 months prescriptions, so that they don't have to be coming to the hospitals for prescriptions all the time. Apart from that, we're able to do phone calls, phone call consultations. So they're able to
How
discuss.
easy is that, especially in Nigeria?
Oh, well, funny enough, I think my hospital managed that very well because we have hotlines for the unit where our vulnerable patients can actually call in, they discuss their symptoms, and then we tell them what they need to do. And that has worked for us thus far.
Do you think it's the future of emergencies or situations like this?
You mean if people are ill and they have to come to hospital?
Yes, telehealth, you know, calling via the telephone.
Oh, definitely. I think this is actually harbinger for that. It's something that we have to consider very.
But if we have such a person, a sickle cell patient, contracting COVID-19, what happens?
Well, where they contract COVID-19, they're advised to actually come to the hospital. We have to, ideally, they should be isolated as well, not in the isolation ward, and monitored, at least for 2 weeks.
And perhaps another question is, how do you identify that this is COVID-19 from someone who has sickle cell in terms of the symptoms of COVID-19? How you differentiate that?
Okay, so that could be a little difficult because some respiratory symptoms that we have in sickle cell actually mimic COVID-19, especially an entity we call the acute chest syndrome, where they present with fever, they present with cough and breathlessness. So such patients have to be tested for COVID-19 and managed accordingly.
All right, we'd like to appreciate your time on the program. Dr. Olufunto Kalejaye, a consultant physician, hematologist. Thank you for joining us on the program.
Thank you for having me.
And in Kano State, the governor has been commenting on the report, the state's retrospective review of case mortality committee, which reveals that the mysterious deaths were COVID-19 related. According to the report, only 15.9% of the deaths are COVID-19 related, representing 255 persons out of the 1,774 deaths recorded in the state. This report contradicts that of the ministerial task team, which revealed 50 to 60% of the deaths were COVID-19 related. Receiving the document, Governor ABDULLAHI says the report of the ministerial task team lacks merit and did not represent the actual event relating to the mass deaths. The Chinese capital, Beijing, has now been turned into a coronavirus prevention bubble, meaning if you haven't done a test within the last 7 days, you're not allowed to leave the city. However, virus testing capacity is limited and priority is given to hundreds of thousands of people who have either been to the Chifadi wholesale market or live nearby. All of these residents are prohibited from leaving Beijing under any circumstances, but some others who fear of the new wave of infections are leaving the city regardless. Here's more on our global update.
Brazil has set a new record of daily cases. Over 34,000 patients were registered as having coronavirus in the past 24 hours. There are now more than 920,000 cases in the country, second only to the US, and nearly 1,300 deaths were registered, taking the death toll to over 45,000. Health officials say the infection rate is showing no signs of slowing down. At this rate, Brazil is likely to register 1 million cases by the end of the week. Fear of a new wave of coronavirus infections in Beijing is making some travelers who are weary of the rising cases to flee the city as authorities ramp up efforts to contain a new outbreak in the Chinese capital. Health officials recorded 31 new confirmed infections, bringing the cumulative infections since June 11th to 137 cases, the worst resurgence of the disease in the city since early February. President Juan Orlando Hernandez of Honduras says he, his wife, and 2 of his aides have tested positive for COVID-19. In a televised address, he said he began feeling unwell over the weekend and his condition was confirmed on Tuesday. However, he says he is feeling better and would continue to work remotely. And Spanish Prime Minister Pedro Sanchez has announced that Spain would hold a tribute for the victims of COVID-19 and frontline workers on July 16th. The country wishes to open its borders to EU and Schengen area countries on June 21st, hoping to boost its tourism industry, which generates 12% of the country's GDP.
And from the NCDC, what can you do to reduce the risk of COVID-19 spread in the workplace? What should you do if an employee develops symptoms or tests positive for COVID-19? You can visit their website. It has guidelines for businesses and employers in Nigeria and other useful guidelines with all the information, statistics of cases across the country. From the World Health Organization, the live feed has so many updates. You can find the situation dashboard, an interactive map that provides the latest global numbers by country of COVID-19 cases on a daily basis. Each moment, it keeps updating the number of cases, the number of deaths, and the recovery efforts across board. Our website, channelstv.com, has the latest news. All you need to do is log on, access news in health, politics, business, sports, Africa, and around the world. That's all at your fingertips, channelstv.com. That's the COVID-19 update. We're back again at 6. I'm Millicent Walker. Stay with Channels Television, your home for the news.